A do-it-yourself approach to treating Parkinson's disease in Tasmania has led to a university clinical trial in Australia. It began with the group of Tasmanians who were living with Parkinson's discovering that putting red light helmets on their head twice a day was halting the progression of their symptoms and improving their quality of life. They've inspired the clinical trial that's now underway across Australia to find out if the lights are actually making a difference or if it's just the placebo effect at work.
At a home in Tasmania's northeast, a retired specialist doctor and an electronics expert are developing infrared light helmets, devices they say are improving lives.
For people with Parkinson's, the red lights are giving them an improvement now, right now. They're not having to wait 10 years for a pill.
Catherine Hamilton started using red lights in 2016 to improve her own arthritic knee. While there isn't any definitive science on the treatment, she believes red and near-infrared lights can regenerate old cells and help create new ones.
They're able to penetrate a cell and then pop a little pulse of light energy into the cell battery called the mitochondria. And the cell battery, if it's been unhappy because the cell isn't functioning well, the cell battery will go, "Ooh, thank you, I like that," and start promoting some activity of the cells.
Former federal MP Max Burr has Parkinson's disease. He says he was the first Australian to test the lights on his head.
I could literally have fried my brains. I didn't know. But I was prepared to take the risk because there was no other form of treatment that could offer any improvement to the condition.
Mr Burr's been using the lights for 20 minutes twice a day for the past 3 years. He says his shaking has calmed down enough to play the piano again, while most of his other Parkinson's symptoms have subsided, and he's not the only one.
I'm much happier, feel a lot lighter, shake less, laugh more.
Members of the Dorset Community Shed are now making their own version of Mr Burr's helmet. There's demand from people suffering a range of neurological conditions. 63-year-old Grace Winiecki is convinced she's better now than she was 7 years ago.
But it certainly improves a lot of symptoms, and we're getting a lot of good feedback from people who are using the lights, so it's a huge coincidence if they all are getting better just because they're wearing a bucket on their head.
While many people claim these red light helmets are helping their brain, many health professionals remain sceptical, as it's yet to be scientifically proven if they're making a long-term difference. But a team of researchers in Sydney are hoping to change that. Dr Liebert and her team are running a clinical trial involving Parkinson's and non-Parkinson's patients in Sydney, Brisbane and South Australia. They hope to show that the reported improvements aren't the result of a placebo effect and the normal waxing and waning of Parkinson's.
The main hope is that we can capture and replicate what the clinical observations have been over the last few years in Tasmania, in other centres around Australia, and that we can characterise and predict who would be able to benefit from the helmets if it's a sustained improvement.
The first results of the trial are expected later this year.
I think that it will open up much broader opportunities or possibilities for the medical profession that haven't yet been discovered.
There's a huge amount of work that went into designing it, and now that that's done, I can sit back and hopefully get some good news from all the trials that have been carried out.
But whatever the results, this pair say they'll keep making their light devices anyway. Manika, Dadson, ABC News, Lilydale.